Okay. So today's topic is actually my final topic with you, which is on the second part of the bleeding disorder, the coagulation defect and thrombophilia. So basically, the last topic that I discussed with you was on disorders, bleeding disorders, if it involves vascular problem as well as platelet problem. So hari ini we're discussing on what happens, what are the diseases that commonly occur when you have problems with your clotting factors, okay, and then thrombophilia juga lah, when there is when your body prone to produce thrombus, okay, causing you to have thrombophilia. Okay, all right. So I think everybody knows what coagulation is. So this the process is quite complex because you have the intrinsic and extrinsic pathways that merge together at the very end of the process to form the common pathways. Okay, so these besides the vascular and platelet phase, the first the primary hemostasis, coagulation also plays a very important part to prevent any further bleeding, if any. Okay. Okay. Alright, so again, just a recap, your body maintains homeostasis by making sure that your vascular remains constricted, and then you form the primary hemostatic plug, which is from the platelet aggregation and activation, and then you've got your blood coagulation lah. Okay, the clot will form upon the conversion of fibrinogen to fibrin. Okay, and then lastly, of course, we've got the thrombotic counter-regulation to make sure that you do not produce excessive thrombosis that can lead to clotting problems later. Okay, all right, so this is just showing you the clotting sequences when it involves the clotting pathways. Okay, so we've got so by now you understand that we have a few ataupun we have bleeding defect, a vascular defect that can cause bleeding disorders. We've got platelet disorders, okay, that can cause bleeding. And then now, today, we are going to discuss a bit on factor deficiency. What happens if you do not have adequate clotting factors, the protein factors? What are the things that could happen, okay? Alright, so the commonly seen at the hospital when it comes to coagulation problem adalah in terms of primary. Okay, we've got primary and secondary. Primary adalah Haemophilia A, Haemophilia B, and von Willebrand's disorder. Okay, kalau if it's acquired, okay, probably selalunya disebabkan oleh if you have secondary causes lah, okay, because of drugs, because of other diseases, okay, such as liver problem, ataupun you have vitamin K deficiency. Okay, alright, so Haemophilia A ni basically there's a lack ataupun kekurangan of your blood clotting factor number 8. Okay, so a lot of cases we see compared to Haemophilia A and Haemophilia B adalah Haemophilia A lah yang paling common lagi. Okay, around 80-85% lah of these hemophiliacs, they have the type A hemophilia. Okay, Haemophilia B is caused by deficiency in your factor 9. Okay, so senang lah nak ingat A factor 8, B factor 9. Okay. And then we've got another hemophilia type C, not that very common. Some doctors, they use this term to refer a lack of clotting factor 11, okay, X1, 11, alright, which is not that common lah compared to A and B. And von Willebrand disorder, I think I've introduced this disorder previously. So this is part of the factor 8 molecule. You've got your von Willebrand factor, which is reduced, tak cukup. Okay, so kenapa von Willebrand factor is very important? Because it involves in helping the platelet to attach to the lining of your vessels. Okay, so kalau you tak cukup this von Willebrand factor, you can get prolonged bleeding time. Sebab platelet you tak boleh nak attach to the wall of the vessel, and then tak boleh nak, when there's not enough platelet segregate dekat situ, you cannot form the hemostatic plug to stop the bleeding. Okay, so presentation dia lebih kurang macam hemophilia A and also hemophilia B, but it is much more common compared to hemophilia, and the punya presentation is much more milder daripada hemophilia. Okay, so this is showing you the overview of hemophilia. Most of these hemophilia are X-linked recessive disorder. Okay, so this is a bleeding disorder because you are either deficient ataupun absent of a specific protein, okay, that is required for your body to form a blood clot. Because of this deficiency, that person bleeds longer after an injury. Okay, so this specific protein is yang factor 8, factor 9 tadi, it's related to your clotting factors lah. Okay, so kita ada berapa, if you remember, we've got 12 clotting factors which contributes to the process of clotting. Okay, so if you remember, kalau you ada vascular and platelet problem, you punya bleeding tu tends to be on the mucous membrane dekat superficial. If it's involve coagulation disorder, the bleeding is often deeper, okay, into the joints, into the soft tissue, you get deep hematoma. Okay, so this hemophilia adalah sex-linked recessive disorder. When we say it's sex-linked ataupun X-linked, it usually affects the males, orang lelaki, boys. Okay, and in almost 30 to 35% of hemophilia A, patient tu dia tak ada pun family history. Okay, so about 30% are spontaneous, but most of them are due to these sex-linked recessive disorders. Okay, kenapa yang 30% ni boleh dapat hemophilia A? Mungkin ada spontaneous mutation of the factor 8 gene. Okay, so we've got several types of hemophilia. Okay, macam I introduced just now tadi, kita ada hemophilia A, tak ada deficiency in factor 8, hemophilia B for factor 9 ataupun nama lain dia Christmas disease, and we've got also factor C. Hemophilia C yang kekurangan your factor 10, very very rare genetic disorder. Okay, alright, so when somebody has hemophilia, we classify them according to the severity. Okay, sama ada severe ke, moderate ataupun mild. Okay, dia punya kalau if it's severe, that means you have about, memang tak ada langsung lah, probably like 10% of the anti-hemophilia factor. Okay, kalau moderate tu mungkin about 1 to 3%, mild is less than 4%. Okay, so this is X-linked recessive disorder, so it overwhelmingly affects male, okay, boys, 70%. Okay, so it is entirely confined to the males. So kalau macam you ada ayah, if a father is hemophilic, okay, hemophilic, the daughter usually akan jadi carrier. Okay, so kita boleh detect the potential disease kalau kita buat prenatal diagnosis. Okay, sama ada kita buat fetal DNA ataupun fetal blood analysis. When the baby is in utero, kita boleh ambil sampel and we check for the genetic punya abnormality. So we can detect lah sama ada the baby boleh ada hemophilia ataupun tidak. Alright, so hemophilia A. So nama lain adalah classical hemophilia. So there's a dysfunctional in your factor 8. Okay, sama ada, remember 70% is because of inherited, 30% is because of gene mutation. Okay, so prevalence ni about banyak juga lah, but in western countries lah selalunya. Okay, 30 to 100 per million population. Okay, another hemophilia adalah hemophilia B. Nama lain dia adalah Christmas disease. Kenapa Christmas? Is it discovered masa Christmas Eve ke apa? No, it is named after a young boy. Nama dia Stephen Christmas. Okay, who was found to be lacking this factor 9. Okay, so that leads to the discovery of this factor 9 deficiency lah. Okay, so budak ni in 1950s if I'm not mistaken, okay, in early 1950s macam tu. So this is also macam hemophilia A, it is X-linked, so it usually confined to boys. Okay, dulu Okay, last time Haemophilia B was once called the royal disease, penyakit diraja, because Queen Elizabeth of England, not Queen Elizabeth, Queen Victoria. Queen Victoria of England, dia pass but the carrier, dia pass the mutation, the factor 9 mutation through several royal families in Europe. Okay, because it is inherited in a recessive X-linked factor. So males primarily are affected and then they become symptomatic. Yang females are usually carriers. Okay, so this condition was known to be transmitted among the European royal families who were the descendant of this Queen Victoria of United Kingdom lah. Okay, Queen Victoria's 8th child, Prince Leopold maksudnya. Okay, the Duke of Albany was haemophiliac. So Prince Leopold died because of the haemophilia B at the age of 30, 31, 32 macam tu. Okay, but now I think there's no cases lah kot because they dah tak ada kahwin among themselves. Okay, they have already spread out. Okay, so the potential of getting haemophilia B is less. So that's why in Islam pun kita tak digalakkan untuk berkahwin sesama which are related kan, because this is one of the problems that might rise. Okay. Okay, so what are the what are the manifestation kalau somebody has haemophilia? Okay, of course the symptoms include excessive bleeding. Bleeding boleh terjadi externally because of any injury, tapi selalunya dia akan dapat spontaneous bleeding into the joints. Okay, can you just give me 1 second? I need to okay, ada lag pula. Okay, alright, sorry. Where was I? Okay, clinical presentation. Bleeding, macam saya kata tadi, dia boleh terjadi dekat dalam joints. Okay, contohnya ataupun dia boleh dapat spontaneous bleeding ataupun bleeding in any procedure ke apa. Contohnya macam kalau the boy undergo circumcision, bersunat kan. So mungkin that is the first evidence. Sebelum ni tak ada bleeding pun, tak ada masalah bleeding, tapi lepas bersunat tiba-tiba lepas di minor surgery, dia oozing, continuously bleed daripada dia punya side tu. Okay, ataupun kalau macam babies, maybe dia punya symptoms tu tak adalah they presented with bleeding from the nose ke, bleeding from the mucosal membrane until the babies become mobile. Baby bila duduk terbaring dia tak terlanggar apa-apa, tak apa. But then when the baby who has haemophilia, they start to crawl, they start to berjalan, bertatih and all, then the symptoms may become evident sebab mungkin dia terjatuh, terlanggar tu. Okay, so he can get bleeding from the mouth due to the injury, bruising because of the internal bleeding sebab terhantuk bucu meja ke, terhantuk lantai, terjatuh ke. Okay, if they have recurrent spontaneous bleeding into the joints, this can lead to joint deformities and arthritis in later life. Okay, so it depends lah on the level of factors that is deficient. So patient can be presented with all this. Okay, taklah semua. Sometimes depends on the patient itself, berapa banyak dia punya level of deficiency, okay, how well the body responds. Okay, so paling penting, if the bleeding is not treated properly, dia boleh menyebabkan crippling deformity. Okay, so selalunya babies they haemophilia ni, they won't have the symptoms until later in life. Okay, tapi dia boleh di-notice, boleh diperhatikan during infancy ataupun childhood lah, when they start to move around. Okay, kalau macam bleeding into the muscle, lepas dapat suntikan vitamin K, okay, so ada lebam dekat kawasan suntikan, ataupun mungkin lepas bersunat tadi tu macam saya kata dia ada oozing, bleeding. Alright. Okay, so these are some of the symptoms lah. So you see, this can be a very a deformed knee joint because of recurrent bleeding into the joint space. Okay. So remember, if it's not treated well, it can lead to deformity of the joints. Susahlah budak tu nak berjalan, nak bergerak. Okay. So the diagnosis of haemophilia is made based on the patient's presentation, the symptoms, of course, from the family history, and also bleeding test. Okay, so diagnosis include, of course, paling basic, we need to do full blood count to know the platelet level. Okay, we do coagulation studies, alright, because we know that the clotting factors are deficient. So certain investigative time, contohnya prothrombin time, activated partial thromboplastin time would be prolonged. Alright. Platelet count are usually normal because it doesn't involve any platelet issues. Yang masalahnya adalah your coagulating proteins tu. Alright. And then of course we can do specific factor assay. Kita boleh focus on knowing or investigate the level of factors, either factor 8 or factor 9. So usually it is low lah for this haemophilia A or haemophilia B. Okay, and if we suspect that there's a recurrent bleeding, we want to make sure that the joints are okay, we need to do joint x-ray. Okay, and of course for the investigation, one of the ways to we want to prevent any further siblings and any further offspring being produced with haemophilia, so kita akan buat genetic counselling. How do we treat? Okay, treatment should be given at the earliest sign of spontaneous ataupun post-traumatic bleeding. So the treatment consists of course kita nak replace any deficient factor. Okay, so kita boleh replace the factors routinely untuk control the spontaneous bleeding. Contohnya macam apa? Kita boleh bagi prophylaxis, prophylaxis factor concentrate. Let's say if we know that the patient is going to go for a dental surgery ke any surgery, any procedure, then we can give prophylaxis before or prior to the procedure. Okay. In mild to moderate cases, we may not need to administer factor 8, but kita boleh bagi dia desmopressin, DDABP. Okay, so this desmopressin, dia akan menyebabkan a temporary rise in your factor 8 and your von Willebrand factor. So we can give them secara intravenously or subcutaneously, or kita boleh bagi through nasal spray. Okay, because it is quite expensive kalau kita nak bagi factor concentrate ni. Okay, so we one of the risiko kalau kita bagi factor concentrate, there is unnecessary exposure to blood-borne virus lah. Walaupun kita buat very thorough screening of the blood component before we transfuse them, but there are still risks yang kita have to keep in mind. Okay, that sometimes the donated plasma may be contaminated ke apa. Alright. Another another type is ataupun another option is there are we can give them recombinant factor replacement which is a genetically engineered factor 8. Okay, this is free from contaminating virus but sangat mahal. So this is considered as one of the alternative treatment. Okay. Alright, so what are the complications that may arise from haemophilia? Paling common adalah joint damage ataupun kita panggil hemophilic arthropathy. Okay, this occur when there is bleeding into the joints lah, and then kita tak treat dia betul-betul. Okay, so this is the most common complication of haemophilia, bleeding into the knees, into the elbow, ankle joint, shoulder. All this can lead to chronic swelling, pain, immobility, and then eventually you can get joint deformity. Okay, another complications adalah in the past we have recorded cases of patient contracted hepatitis C, hepatitis B from the transmitted from the contaminated factor concentrate. Tapi sekarang ni we see less and less, jarang sangatlah we see all these complications because of very stringent screening processes. Okay, kita screen the donor, and then kita screen we do all the lab testing before we transfuse the blood concentrates to the patient. Alright. So we certain patient they have kalau dia mampu dia boleh beli factor concentrate and then they can use it at home. Okay, so dia dah pandai lah macam nak cucuk sendiri. Alright. Okay, so this table is showing you the comparison between Haemophilia A and Haemophilia B. Okay, so you tahulah Haemophilia A factor 8, Haemophilia B factor 9. Okay, and nama lain dia classical, satu lagi Christmas disease. Antara A and B, A is more common compared to B. But comparing Haemophilia A, B and von Willebrand is more common. Okay, severity Haemophilia A ni usually much more severe lah compared to Haemophilia B. And because you have deficiency in factor 8, bila kita buat investigation, kita kena test for the factor 8 concentration, which is usually low. Kalau factor Haemophilia B, kita tengok factor 9. Okay, and this is the treatment modality. Okay, because hemophilia adalah a lifelong disease, so usually we advise the patients to, they have this the carry medic alert bracelet lah. Okay, nak bagi tahu that they are hemophilia in cases kalau macam emergency, they ada accident ke apa, so people know that they are hemophiliac and needs proper treatment. Okay, and even in Malaysia pun kita ada Malaysian Haemophilia Society. Okay, so this table showing you the comparison between Haemophilia A and B and von Willebrand factor. So you boleh tahulah dekat sini. Okay, remember Haemophilia A and B is X-linked. It is sex-linked related, whereas von Willebrand disease is an autosomal dominant. And the bleeding is usually superficial. This one is more deeper. Okay, platelet count both are normal because it does not involve the platelet punya problems. Platelet aggregation, Haemophilia A and B is normal, but in von Willebrand disease it is impaired because remember von Willebrand factor is needed for the activation and segregation of the platelet. Okay, bleeding time, which is usually shows reflects the platelet function. For Haemophilia B and A is normal because it has nothing to do with platelet, but bleeding time for von Willebrand factor, of course, it is prolonged because of the problems with the platelet aggregation. Okay, and then PT all normal, APTT is prolonged for Haemophilia A and B. Okay, nanti kita go what is PT and APTT. Okay, so that just now was the inherited. Okay, now we go very briefly on what are the acquired coagulopathy that can occur in patients. Okay, so first one is vitamin K deficiency. So vitamin K is very important because your body needs vitamin K to form the blood clots and to stop the bleeding. Okay, so we usually get the vitamin K from the food that we eat, and some vitamin K also is made by the good bacteria that live in your gut. Okay, babies, they are born with very small amounts of vitamin K stored in the body. So kalau kita tak supplement vitamin K to the babies, they can this can lead to serious bleeding problem. So one of the problem adalah hemorrhagic disease of the newborn, which is a rare bleeding disorder which can occur after birth. Okay, so the hemorrhage is quite bad lah. It's a life-threatening condition. Okay, sebab vitamin K ni, it is not efficiently passed from the mother to the baby in utero. So most babies they are born with low storage of vitamin K in their system. So sebab tu bila baby lahir saja, kita akan bagi vitamin K injection sebab kita nak prevent this hemorrhagic disease of the newborn. Okay, hemorrhagic disease of the newborn. Okay, so we give parenteral vitamin K. Baby lahir je kita cucuk dekat dia ni peha, kita bagi the vitamin K supplement. Okay, sebabnya if they, we see a lot of families yang anti vaksin satu, and then semua tak nak, semua anti all this. Okay, and then dia tak nak refuse to give vitamin K injection to the baby. So what will happen to the baby? Early onset mungkin tak nampak lagi within 24 hours of birth tu. Usually the classical presentation hari kedua, dalam masa seminggu tu, hari kedua sampai hari kelima, hari ketujuh macam tu, they can have dia akan perasan baby dia tu macam tak aktif, mungkin macam mama-mama macam tu. Okay. And this is selalunya bleeding dekat intracranial. Okay, bleeding from the brain lah. Okay. Tapi so classical between day 2 to day 7 after birth. Sometimes they can also be presented, the hemorrhagic disease tu can be presented later. Okay, late onset, mungkin 2 minggu lepas kelahiran, 3 minggu, 4 minggu macam tu. Okay, so there are a few reasons why newborns are prone to this vitamin K deficiency. Macam I kata tadi, storage in the vitamin K's are less, and then second one, vitamin K is not only small amount of vitamin K is transferred across the placenta during pregnancy, and then even if we breastfeed pun, human breast milk contains small amount of vitamin K too. Okay. And then the primary gut flora found in the breastfed babies, they do not really synthesize vitamin K. So that's why we need to supplement the vitamin K to these newborn babies. Okay. So this vitamin K deficiency, baby ni akan tak boleh nak stop bleeding sebab darah dia tak cukup vitamin K to form the blood clot. So dia boleh terjadi kat mana-mana, inside or ataupun outside the body. Okay, masa mula-mula kena tu ataupun mula-mula ada bleeding inside the body, it can be quite difficult to notice. Okay, so bleeding sama ada in the brain ataupun in the intestine. Okay, so these can lead to death. Alright, so remember, babies who do not receive vitamin K shot at birth, they can develop this hemorrhagic disease of the newborn at any time from, between day 1 of upper life sampailah 6 months of age, any time between that. Okay. So all babies, regardless of their sex, their race, their ethnicity, they all have a high risk to have this vitamin K deficiency until they start to eat regular food. So bila baby start to eat regular food, maybe around 5 to 6 months. Okay, this is also when the normal intestinal bacteria will start to make the vitamin K. Okay, so lambat sikit lah kalau dia nak ada their own vitamin K production. Alright. And certain drugs ataupun certain systemic disease can cause malabsorption of the vitamin K, causing the patient to have deficiency as well. Alright, liver disease. Alright, so liver produces a lot of clotting factors except von Willebrand factor. They don't produce that. Okay, so anything that damages your liver can affect the clotting factor production. Okay, so how do we treat? Kita kena treat lah what caused the liver disease, but it's usually quite difficult to treat patients with liver disease. But when they have bleeding can be multifactorial. Okay, mungkin bleeding from the esophagoviruses, from gastritis, from peptic ulcer. All these needs to be controlled first. Alright. Anticoagulants. Okay, patients who are taking anticoagulants, they have problems with their blood clotting. Okay, because anticoagulants can prevent coagulation. Nama pun anticoagulant, so they prevent coagulation. Okay, who are the people who takes anticoagulant? Okay, those who have problems like deep vein thrombosis, yang pernah ada history of pulmonary embolism, yang pernah ada heart attack, yang pernah ada stroke, we usually give them anticoagulants. Okay, so this is a medication. Anticoagulant is a medication, obat. These are the common anticoagulants that we use lah. Okay, warfarin ataupun heparin. Okay, so you see vitamin K helps with the clotting, but antagonist kepada vitamin K adalah coumadin, or nama lain dia warfarin. Okay, warfarin causes dia anticoagulant, dia menghalang daripada penghasilan blood clot. Okay, so coumadin ataupun warfarin, so dia melawan efek kepada, it opposes the vitamin K effect. Okay, salah satu contohnya adalah warfarin, we give them orally. Okay, and because warfarin can cross the placenta and causes teratogenic effect, so we do not give to pregnant mothers. Okay, and it takes about 2 to 3 days before the effect can take place lah. Okay, so so kalau macam patient yang ada bleeding tendency, and then dia on warfarin, selalu kita akan stop lah the warfarin. Okay, and then kita bagi fresh frozen plasma, and then kita akan bagi vitamin K untuk counter back the warfarin effect. Another anticoagulant adalah heparin, very very commonly used in the hospital. Okay, this one does not cross the placenta, so kita boleh bagi dekat patient pregnant ladies yang ada deep vein thrombosis. Okay, so kita boleh bagi bawah kulit subcutaneously ataupun intravenously. Okay. Alright, and DIC, disseminated intravascular coagulopathy. Again, I've introduced these to you before. These can lead to coagulopathy as well. Okay. So these are some of the presentation of a DIC patient. Okay, you can see a lot of bleeding punya presentation lah or manifestation. Okay, lab test. Okay, so the screening tests are usually useful in diagnosing a patient who give a history of excessive bleeding includes your blood count. Okay, full blood count. So kita of course want to look at the platelet count. We can do blood smear ataupun blood film if we suspect that the patient kalau ada bone marrow problems ke apa. Okay, any infiltrative disorders ke, or we can look also to test the vascular platelet phase. Kita boleh check for the bleeding time. Bleeding time selalunya melibatkan platelet, and we can check for the coagulation cascade. Sama ada we do PT or APTT. Okay, so bleeding time, what is this bleeding time? So this is the time taken from the puncture of the blood vessel to the stopping of the bleeding. Okay, so dia ada method lah. One of the method is called a Duke. Okay, dipanggil Duke method, D-U-K-E, Duke method. So patient tu kita akan prick dekat fingertip, sometimes dekat earlobe kita prick with a special needle, and then lepas kita dah swab with alcohol. So lepas kita prick, patient tu akan wipe the blood every 30 seconds with a filter paper. So starting the prick tu sampailah bleeding stop, so kita akan kira berapa lama the bleeding stop, the bleeding time dia tu. So usually less than 6 minutes, okay, between 2 to 6 minutes. Okay. So this bleeding time is useful to test platelet plug formation and capillary integrity. Okay. So bleeding time is affected if you have problems with your platelet. Okay. So these are the causes for bleeding time, prolonged bleeding time. Sama ada tak cukup platelet, number of platelet cukup tapi dysfunction, okay, ataupun you have one Willebrand diseases, DIC, or certain drugs can cause prolonged bleeding time. Anything that kacau with your platelet function. Okay. Prothrombin time, we don't really sekarang ni kita jarang dah lah tengok bleeding time ni, sebab we can usually just look at the platelet number from the full blood count. Prothrombin time, this is most commonly measured using your blood plasma. Okay, kita ambil darah, withdraw blood dalam tube, and then dalam tube tu kita ada citrate. Okay, citrate ni dia it acts as an anticoagulant. Dia akan bind with the calcium in the sample. Okay, so kita mix the blood, centrifuge, and then we separate the blood cells from the plasma. So the plasma is analyzed in a machine, and then ada a few steps lah. Kita masukkan tissue factor, okay, factor 3, and then kita tengok berapa lama yang diambil untuk blood tu clot. Okay, so this prothrombin time, okay, is used to determine the clotting tendency, and then to measure the warfarin dosage, liver damage, and vitamin K status. For example, if a patient is given warfarin, okay, kita tahu warfarin ni dia anticoagulant. Okay, so kita every time kita bagi warfarin, kita kena adjust dose warfarin tu. Okay, nak tengok sesuai ke tidak dengan dia punya level. So macam mana kita nak tahu the dosage suitable for the patient? Kita kena check the patient's punya PT time. Okay, and PT time is usually very sekejap, less than 15 seconds. Okay, so kalau let's say warfarin, kita bagi patient tu makan warfarin and then dia PT dia 20 saat, 30 saat, that means it is prolonged. So kita mungkin kena kurangkan dose warfarin, and then kita check lagi. So that is how we play around to make sure that the warfarin dosage is optimized lah for that patient. Okay, so prothrombin time, it measures your factor 1, 2, 5, 7 and 10. Okay, alright, so this is showing you apa yang prothrombin time check. Dia tengok dekat intrinsic pathway. Okay, intrinsic pathway, extrinsic pathway. Extrinsic pathway as well as the common pathway. So kalau you ada problem dekat factor 8 ke factor 10 ni, factor 2 ni, that means your prothrombin time will be prolonged. Okay, APTT, activated partial thromboplastin time. Okay, so this kalau PT tadi dia tengok dekat extrinsic pathway, APTT tengok dekat you punya intrinsic and common pathway. Okay, and PT tengok warfarin, APTT dia tengok heparin. Okay, another anticoagulant juga. Alright, if your APTT is longer than the normal clot, then kita kata your APTT is prolonged. Okay, so when a PTT selalu kita tak tengok asing-asing PT dengan APTT tu, kita tak tengok asing. Selalu kita akan kata okay, check for the coagulation profile of this patient. Orang nurses tahu kita akan tengok PT and APTT. Okay, so sebab kita tengok pada dua-dua. Okay, the both intrinsic and extrinsic. So if the APTT is prolonged, then you know somewhere in the intrinsic and common pathways are having a problem. If the PT is prolonged, then you know the extrinsic and the common pathways probably having a problem. Okay, so we can determine the cause of the clotting disorder, which factor is involved. So for APTT, the value is less than 30 seconds lah, around 30-35 seconds macam tu. Okay, so anything that affects the intrinsic pathways akan menyebabkan prolong of your APTT. Okay, kalau ada deficiency in factor 12, 11, 9, 8, 10, 5, okay, factor 2, factor 1, all these can prolong the APTT. Okay, so APTT check dekat your intrinsic pathway and common pathway. Okay, kalau you ada normal APTT result, mungkin it doesn't mean that you are normal, tapi patients tu ada bleeding, so mungkin they just ada a very mild deficiency of that one single coagulation factor. Okay, tapi kalau that factor dah decrease sampai 30 to 40% from the normal level, then you can have a prolonged APTT. Okay, so the APTT may not be prolonged until the factor levels have decreased to at least 40% of the normal level. Okay, so what can cause prolonged APTT? Anything that affects the liver, because we know liver produces the coagulation factors. If you have vitamin K deficiency, if you're taking heparin, okay, all these can lead to prolonged APTT. Okay, so this is just summary of what PT, what APTT and what bleeding time do. Okay, so PT less than 15 second, 10 second macam tu, dia akan check your extrinsic and common pathways. Okay, so these are some of the abnormalities. For APTT, a bit longer. It looks or it gives you the idea if you have any intrinsic or common pathways problem. Okay, and bleeding time usually for platelet and capillary integrity. Okay, so last part is on thrombophilia. Thrombophilia, this is when you have an alteration in the normal blood constituent. You can get the tendency to form blood clot, which is another term for that, thrombosis lah. Okay, so thrombophilias are disorders of hemostasis that increase your tendency of blood to clot, hypercoagulable state. Okay, it can be inherited, it can be acquired. Okay, alright. So okay, thrombophilia ni increased tendency to thrombosis. Alright. So anything that causes imbalance, okay, will lead to the imbalance in your homeostasis. So remember, for hypercoagulable state, okay, any inappropriate activation of your blood clot in uninjured vessels ataupun thrombotic occlusion from the vessel after minor surgery can cause all this lah. Okay, so what can predispose your body to have this thrombosis? Sama ada you ada masalah dengan you punya vessel wall, okay, ada injury kat situ that promotes all the platelets to come in and form the clots, ataupun you punya pengaliran darah tu very slow, stasis, slow blood flow. So when the blood flow is very slow, dia menyebabkan dia berlanggar-belanggar, so dia senang nak berkumpul. Okay, so this can make you prone for thrombosis. Ataupun you ada hypercoagulability state. Okay, that means you are very prone, the blood is very prone to form a thrombus. Okay, yang paling penting is your endothelial integrity lah, yang vessel wall ni. Okay, it's the most important factor. Injury to the vascular wall can affect the blood flow and also can affect your coagulable state. Okay, abnormal blood flow can in turn cause endothelial injury. Okay, so tiga-tiga ni dia berkait. Okay. Okay, so these are some of the hereditary or primary thrombophilia. Okay, hereditary thrombophilia should be suspected in patients with a history of recurrent thromboembolism, ataupun dia ada history of thrombosis at a very young age, ataupun ada family history of thrombosis. Okay, so these are some of the hereditary thrombophilia lah. Okay, selalunya because of dia ada prothrombin, dia ada gene mutation that predispose them to have this thrombosis. This is just some of the summary of what causes this deficiency and lead to thrombosis and how they present. Okay. And then selalunya this is most common sikit lah compared to yang primary. Okay, secondary ataupun acquired thrombophilia. Okay, probably because of advancing age, bila kita makin berumur, kita punya blood flow pun the valving, the pumping efficiency berkurangan. Okay, so there's a risk of stasis, kita tak banyak gerak. Okay, prior thrombosis, pernah ada history of thrombosis before this, keeps you ataupun gives you the chance of higher thrombosis formation. Immobilization, you tak banyak bergerak. Okay, contohnya macam kalau patient tu atau orang tu selalu travel, okay, prolonged air travel can lead to stasis. So sebab tu kalau you travel on the airplane and the journey is very long, 10 jam, 12 jam, we advise the passenger to always move around, exercise sikit. Okay, nak make sure that there's no blood stasis that can predispose to thrombosis formation. Okay. Surgery, malignancy sebab the tumor cells sometimes they release procoagulant substance that akan activate the clotting formation. Okay, so dia ada thrombogenesis feature lah. Okay, estrogen therapy contohnya they increase the plasma level of certain coagulation factors. Okay, so dia menyebabkan patient prone to get blood clot. Okay, and some other causes like pregnancy, obesity, antiphospholipid syndrome. So thrombosis during pregnancy can be due because of the when you are pregnant, there's a risk of procoagulant state. Okay, you also have venous stasis. Okay, so these can lead to thrombosis, thrombophilia. A bit on antiphospholipid antibody syndrome ataupun APA syndrome. This is when you have an antiphospholipid antibody. Okay, terhadap your phospholipid lah. Okay, so this causes a very common hypercoagulable factor. So dia ni macam ada antibodies, okay, that mistakenly produce an antibody towards its phospholipids. Okay, so we can test this APA when you catch up these autoantibodies lah yang bind to the phospholipid. So it causes a very excessive blood clotting. Okay, kenapa phospholipid ni penting? Phospholipid ni dia very important in the blood clotting. Okay, it is critical to platelet function in addition to various other factors in the coagulation lah. Okay, so bila ada antiphospholipid antibodies ni, dia akan interfere with the clotting processes. Right, they increase the affected person's risk of developing recurrent inappropriate blood clot dekat artery, dekat vein. So what will happen? They are at risk to get stroke, to get myocardial infarction. Kalau pregnant, boleh dapat recurrent miscarriage. Okay. So APA, most of the cases are idiopathic ataupun secondary. Alright. So antiphospholipid antibodies, these are some of the antibodies that can be detected lah. Okay, kalau orang tu kita suspect ada APA, so usually they have these antibodies. Okay, lupus anticoagulant, anticardiolipin antibodies, anti-beta-2 glycoprotein antibodies. So what are the clinical features? Dia sangat prone untuk clot formation. Okay, in the arteries, in the small vessels. Okay, kalau perempuan and then dia pregnant, and every time dia pregnant dia recurrently keguguran, recurrent miscarriage. So bila kita kata recurrent miscarriage, kalau dia keguguran for more than 3 times, so we need to investigate kenapa dia ni selalu pregnant je gugur. Okay, mungkin dia ada this APA. Okay, so how do we diagnose? Kita kena check dia punya antibodies lah. Okay, yang tadi tu. Okay, and then another condition adalah venous thrombosis. Paling common sekali thrombosis that occur in your deep vein, kita panggil deep vein thrombosis, lalu dekat kaki. Okay, patient perempuan dia akan komplain kaki dia bengkak, kemerah-merahan, okay, sakit. Okay, so probably it's due to DVT or deep vein thrombosis. Deep vein thrombosis is quite dangerous because kalau part of the thrombus dia migrate, dislodge, and then they stuck dekat in any of the the vasculature of the lung, okay, you can dapat pulmonary embolism. Okay, this is a very medical emergency because it can cause sudden dyspnea, sudden shortness of breath, sudden chest pain, sharp stabbing pain on the chest. Okay, so patient boleh collapse because of the respiratory distress. Alright. This is just showing you an example, comparison between arterial and venous thrombosis. Okay, you know artery they have a high pressure, veins they are usually low pressure. Okay. So when to suspect if a patient has this hypercoagulability state? Okay, arterial thrombosis usually has been held to be largely a phenomenon of a platelet activation. Okay, so kalau artery thrombosis tu kita akan fikir platelet lah problem. Kalau venous thrombosis selalunya because of the activation of the clotting system. Okay, kalau patient tu ada family history and then dia dapat recurrent thrombosis at a very young age, okay, so kita akan click lah dekat dalam kita punya mind, probably he has some hypercoagulable problem. Okay, ataupun thrombosis dekat an unusual site. Okay, unexplained spontaneous abortion, very large thrombosis found. Okay, how do we treat ni? We do not have a specific therapy untuk reversekan balik the hypercoagulable state. We have got a few modalities. Sama ada kita guna recombinant factor concentrate untuk control and prevent the bleeding episodes. Okay, and then we've got some other alternative treatment lah. Okay, we can have aggressive prophylaxis against thromboembolism. Okay, kalau macam patient tu tahu, kita tahu dia ada high risk untuk untuk clot formation, kita akan bagi prophylaxis untuk kurangkan dia punya hypercoagulable state tu. Okay, kalau macam dia nak undergo any surgery ke apa. Okay, so kita bagi heparin, subcutaneous injection of heparin a few hours before the operation, like 4, 6, 8 hours before the operation. Alright, so that's it for today's topic. So the take home message, all bleeding will eventually stop. Okay, yang paling confirm akan stop when you die lah. Of course, everything stops. Alright. Okay, any questions? Alamak, suku dah. Any questions you all? Faham tak? Okay. Alright. I'm sorry I have to stop the session earlier because I nak kena ready untuk meeting 10:30 ni. Make sure you log in for the attendance. If you have any questions, please convey the questions to your class rep and then you can class rep can share it to me. I will get back to you with the questions, with the answers later. Okay, so thank you very much. I apologize for these shortcomings. Thank you very much. Take care. We close the session with the recitation of Suratul As and Tasbih Kafarah.